Hi, good evening everybody. Thank you for joining us this evening. We're live on YouTube and Facebook. If you're watching on Facebook, you can submit a question to the panel by commenting below. And if you're watching on YouTube, you can comment your question in the live chat. The Q&A will be around an hour long and we'll wrap up at around 8 o'clock. So you can submit your questions, as we've said, in the comments below to the panel and have them answered live. If you're watching on Facebook, you can click share to share to your live stream with family and friends. And also the session will be available online to watch on replay once we're offline. Unfortunately, Superintendent Sarah Baker isn't able to join us this evening due to operational policing commitments, but I'm absolutely delighted to have with us Alison Haskins and Amy McGarry, and I'm Deborah Harkins, Director of Public Health. So I'm just going to quickly ask my colleagues to introduce themselves. So Alison, do you want to introduce yourself?
Yes, hi everybody. My name's Alison Haskins. I'm Chief Executive of Halifax Opportunities Trust. That's a local charity. We're based in Park Ward to the west of Halifax City Centre, and we do a whole range of things right across Calderdale actually, and that includes helping people find new jobs. We provide training opportunities, and we run a lot of the children's centres, the Sure Start centres across Calderdale.
Fabulous. Thanks for joining us this evening, Alison. And Amy, do you want to introduce yourself?
Yeah, I'm Amy McGarry. I'm a Senior Environmental Health Officer at Calderdale Council. I help manage the food and health and safety, etc. side of environmental health. I'm currently working alongside public health throughout this period.
Brilliant. Thanks for joining us, Amy. And the theme, the topic tonight is tackling COVID-19 in Calderdale. And we know that, unfortunately, because the rates of coronavirus in the borough have gone up since the national lockdown was eased and was relaxed, we know, unfortunately, that the borough is in local restrictions. And partners are working really hard to bring the infection rate down so that we can get our freedoms back and go back to the things we used to take for granted. So we thought it'd be useful for people to ask questions about the work, about the situation in Calderdale, and also about the work that we're doing in the borough. And I thought it might be worth just starting while we wait for some questions to come through, to just say a little bit about the rate of cases in the borough and how that compares to other areas. So when at the end of towards the end of June, when the national lockdown restrictions were eased, the rate of coronavirus per 100,000 people in Calderdale was around 10. The latest data that I've got as of today, the rate is around 37.1. So that's obviously almost 4 times as high as it was when the national lockdown was eased. Just to give you a sense, we have been almost as high as 50 last week as that rate. For the last sort of 4 days, that rate has been inching down a little bit, although we couldn't be confident that that is a downward trend really until we saw it sustained for probably 2 weeks, just learning from other areas that have been through sort of a similar situation. So I hope that just gives a bit of a sense of sort of where we are. The national rate at the moment, to just give you an idea of comparison, is 9.4 and we're 37.1. So almost 3 times the national rate. So what I'd like to do first of all is just ask, I think Alison, first of all, can you see the questions there? Would you like to respond to one of those questions?
Yep, certainly. So the first one I can see here is saying, is there anything that can be done within communities to join up and share messages about reducing the spread of COVID? Yes, I certainly think there is, and I'll mention what I think that is in a minute, but also to say there's already been a lot of activity happening, particularly in the community that we work in, or the communities we work in. We have a particular presence, as I said, in Park Ward, which has seen some of the higher rates of COVID. And there's a lot of community activity there already in terms of spreading some of the key messages related to the more recent restrictions about households meeting up. So we're developing very much a community-driven response to that, sharing very simple messages with people and asking them to share that with work colleagues, with friends and family, because we think some of the best ways to get out the messages are through these sort of low-tech, informal methodologies. And that feels a really sort of straightforward way to go about it. We've been inspired by some schemes around the country, which are sometimes called COVID champions or community champion schemes. So instead of sort of top-down messages, which sometimes aren't received so well, I think if you hear a message from a peer or a friend or a colleague about wearing a mask, about washing your hands, about maintaining a safe distance, about not visiting other households, that tends to go down better, maybe than feeling you're sort of being punished for behaviour.
Thanks, Alison. That's Amy, I can see there's a question here asking about how the council are making sure that businesses are adhering to the local restrictions and keeping everyone safe. Would you like to just answer that question?
Yeah, I can do. So we're doing various things. We're doing some work proactively to go around to certain businesses, largely high-risk businesses that have been identified through other local authorities' experiences as potentially being higher risk than others. We've been proactively going around to those to make sure they've got COVID security measures in place and adhering to guidance, and also to give advice and direction where needed. So we've carried out, there's about 21 high-risk businesses across Calderdale, largely food manufacturers, that sort of thing. We've been and given them advice and checked on their measures, which have largely been very good. We're also dealing with smaller businesses. We've had a number of action days where we've proactively gone out and given advice to smaller businesses, the ones that perhaps have got less access to information and guidance. So we've assisted them. In addition, we're obviously reacting to concerns raised by members of the public or other council teams through their work, and we are reacting to those by making visits, checking compliance, again giving advice and direction where necessary, and following up with more formal action where necessary.
Thank you. Thank you, Amy. I can see some questions coming through now. There's a question here that, if it's okay, I'll answer, which says, if rates are still high and local lockdown rules in place, will we be reviewing opening schools in Calderdale? And I think what's really important is that we know that a lot of children, most children, the vast majority of children, have now gone almost 6 months without going to school. Obviously that for a child is a really long period of long proportion of their lives. And we know that missing out on school, not just, we know that the children have been learning at home and parents have been doing an amazing job of home educating children, but we know that the social element of school and the structure in school is really important for children's outcomes and life chances in the future. So our aim really is to do everything that we can so that children can go back to school. So we are intending for children to go back to school. And actually, even if that means the rest of us need to make other sacrifices so that it's safe for children to go to school, we feel that's going to be probably the most important thing that we can do for children in Calderdale. So you know, the intention is, the plan is that children will be going back to school. There's a lot of work going on, and schools are working incredibly hard, even though it's the summer holidays, getting children ready to go back to school, getting the school ready to receive children safely, to get the arrangements in place for the bubbles, for the teaching, for the resources that are needed. And we're actually going to be organising there's going to be another one of these Facebook Live sessions. I think it might be next week, but please look out for it. That's going to be around focusing on children going back to schools, and also other nurseries and early year settings as well, reopening to more children. So I think the message is, it's really, really important for children to go back to school. So if I just move on and see, there's a question here, Alison, that says, are certain communities allowed to get together, but others not? I don't know if you are able to answer that question.
I'll give it a go, Debs. Well, as we know, we're subject to slightly stricter restrictions in Calderdale, but that does cover the whole of Calderdale. So unless I don't know something that somebody else knows, all communities across Calderdale are subject to that restriction, which is about not meeting other households inside the home or in gardens, and not visiting pubs and restaurants. So yeah, Debs, can I just pick up on something you said about the school issue and early years, because I just wanted to talk about our own experience as a charity. We run, as I said, quite a few children's centres, several of which have got nurseries attached to them, and actually we've been running those all the way, you know, through the strictest times of lockdown, because we were looking after key worker children and some children from vulnerable families. And I really want to assure people that early year settings and schools are following really strict and very good guidelines from central government, and really being so careful about keeping children in bubbles, about removing soft play items. So as I said, we've been open through when rates were, well, actually we're lower in Calderdale, now higher, and we haven't had any incidents you know, of COVID within the nurseries. And I know all early year settings and schools are taking similar precautions, just to reassure people about how seriously schools and early year settings are taking this.
Brilliant, thanks, Alison. And Amy, I can see that there's a question here around why it's not, can you see it? Why is it not possible to meet up in a private garden with another household? If I can meet up with one friend in my garden, we can sit over 2 meters apart. But if I meet up in a cafe outside, it may be less. I don't know, you want to explain the sort of the rationale for that?
I'm not sure there is a given rationale, but my interpretation of that, and what I've read with guidance and the information out there, is that people in their own homes and in private gardens tend to behave slightly differently to how they perhaps would out in the public. You know, we feel more comfortable, and perhaps we are more inclined to become closer to people. Whereas in a public space, there should be the measures in place from that business. If you're in a cafe, for example, those measures will have been considered or should have been considered by the business you're sitting in. In addition to that, there's obviously the issue of going into the toilet. If perhaps you're in somebody's house, you need to use their facilities, and that's, you know, not advisable. Again, because of the household contact issue. I don't know if the others can.
I mean, I think
it's not just
I think
that this guidance says ultimately. So Debs might be able to give a little more.
I think one of the things I would say is that we know that in businesses, businesses are enforced for their health and safety and their public health activity. They're either enforced by Amy and a team, or they're enforced by the health and safety executive. And every business, whether it be the hospitality industry or a different sort of workplace, they have to have a risk assessment. And that risk assessment has to set out really clearly how they're going to keep the customers and the staff safe, and how they're going to be COVID secure. And that's obviously not something we have to do in our own homes in the same way as a business would. But also, all those businesses, as Amy's already said, can at any time be visited by Amy and a team, or by the health and safety executive, to check if they're actually sticking to the rules in the things that the risk assessments say, and adhering to that risk assessment. And again, we don't have that ability in our own homes for someone to come in and check that we're following the rules in the same way. So I understand that's part of the rationale. And I think the question about gardens, I've given a great deal of thought to, actually. And I think with gardens, you know, some gardens might be a really small forecourt or a really small yard, and other gardens may be acres, and lucky people may have acres and acres of space. But again, it starts to get really complicated in the messaging if we're starting to say how big your garden has to be for it to be safe for you to have visitors there. So I guess for me, it's partly about simplicity. It's just no visitors in your garden, because the apologies. I dropped out then, so I don't know where you're up to. Have you answered one of the other questions?
No, we were waiting for you, Deb, so we're so polite.
Okay. Oh, that's lovely. Thank you. I can see that there's some questions about, there's a question here about the balancing the messaging around staying safe and the Eat Out to Help Out scheme to support local businesses. I think there's a question around that, and again, Amy might be able to help out with this one as well. But I think I do understand that it can seem the messages can seem confused, and I think this is why I think it's really important we understand that Calderdale is not subject to a local lockdown. If we were subject to a local lockdown, we wouldn't be going out to the pub, we wouldn't be going out to restaurants, we wouldn't be going to work unless we absolutely had to go to work. But because we've got household visiting restrictions, which is although it's extremely challenging for so many people, because not being able to visit family and friends is really, really hard, and I completely understand that. It's not all, you know, we can still go out and eat out as long as we go in our household. And I think, again, that's partly because of the measures, the enforcement activity, the risk assessments that those restaurants will have, and that balance between supporting the local economy, us having some freedoms and being able to enjoy some of the things we like to enjoy, but also us doing everything we can to keep the infection rate down in Calderdale. I don't know, Amy, if you want to say anything about the Eat Out to Help Out scheme and restaurants, and how we're working with pubs and restaurants. Yeah,
I mean, obviously, we kind of addressed it slightly in the we're taking action where necessary on businesses that are not adhering to what they need to, as well as giving advice and guidance. We are aware of where these premises are. There's a lot of our food businesses are taking up the scheme and are offering, the help eat out to help out. We have given proactive advice to a lot of the businesses. We've done patrols around the town centre, around the wider, Brickhouse, Elland, Hebden Bridge, the whole range of places to give that advice and see where help is needed. So again, it should come down to the businesses being safer, because they should have the measures in place that the government guidance is covering for the nature of those businesses. So we're sort of fairly content that not causing us too much concern, I have to say, a lot of the food businesses. So
that's great. Fantastic. And I can see another question as well, if you don't mind, that I will answer, which is around balancing childcare with work if I usually rely on family and friends. And I do feel that this is a grey area in the guidance. There's very clear guidance that we can't household visit. So we can't have people outside of our household visiting our homes or us visiting them. We also have very clear guidance that we can, our children can go to registered childminders and nurseries to receive care. I think the grey area is where, in order to do our job, and that might be a key worker role, where routinely and usually a family member provides childcare for us. My interpretation of that is a grey area, as I call them, and that's one of the grey areas. And I think this is a real challenge, because you can't just get a nursery or a childminder at short notice, and if your routine childcare is provided by a family member. So when I'm asked this question, I'm actually advising people to continue to get the childcare from that family member. But I do think there are measures that you can take to reduce the chance of transmission. So that's about dropping the child off at the doorstep rather than going into the house when the child's either been dropped off or picked up. I think it is being conscious of the hand washing and social distancing where that's possible. And again, I understand that isn't for younger children particularly, that's not easy, but changing clothes, washing hands and being conscious of the potential transmission. But I do think dropping and picking up on the doorstep as opposed to going into the house and spending time indoors, I think is really important. So I don't know, I'll be honest with you all, whether that's the right answer, but I do feel this, as I said, is a grey area. And I'll just look through the questions to see what others we've got. There's a really good question here, Amy, around why aren't the council naming and shaming businesses? And are we acting on information that's given to us? Would you like to answer that one?
Yeah, absolutely. Yes, we are acting upon information given to us. We're getting a number of concerns raised for different types of premises. We're going out to deal with those businesses. The reason we're not naming and shaming businesses is because we can't due to data protection, and also on ongoing investigations. It might be that these businesses are being ongoingly monitored, and the sanctions that are being imposed on them are being monitored going forward. And it would be inappropriate to name and shame those businesses if we're considering further action. There's a sort of different process we can take different courses of action depending on what our concerns are, and we wouldn't generally do that until we were satisfied that a conclusion to come regarding an investigation. Well, bearing in mind COVID is not going anywhere at the minute, those would be considered ongoing investigations because the businesses are being continually monitored where we've had concerns. So we're not able to sort of provide that information, but be assured that we are out and about 24/7, weekends, evenings, looking into the concerns that are being raised to us and taking appropriate action. So I see Deb's has dropped out again. It might be appropriate to answer a question that followed that, which is on a similar line. Somebody's asked that people are constantly breaking rules in pubs. You want to know what responsibility does the pub have to make sure people are following the rules? Well, pubs, restaurants, businesses should ensure that the businesses are following rules. They're required to take down certain information, restrict the numbers of groups coming in, although it is very difficult because the question, say for example, the 2 households or more issue inside, at the minute we can't meet those outside a household within a pub. The pub has a responsibility to ask that question, but they can only go on the information that is provided by members of the public. So I think it's important to say, whilst there is a lot of responsibility placed on businesses to be complying with guidance, there's also an awful lot of responsibility for members of the public to be following the local restrictions and guidance that is given to them, and do things outside of what is allowed. So yeah, pubs are following the rules that we're finding. There's the odd concern, but by and large, we're finding they have got methods to report information.
Great, thank you, Amy. I'm just conscious, Alison, there aren't many questions for you coming up particularly, so do jump in to the questions that we're answering. I've got a question here actually around a question that says the NHS seems closed for all except COVID. People are getting other illnesses and not able to access healthcare. And I think, and this is a really, really good question and really important, because we think a lot about the direct impacts of COVID, don't we, on on people becoming very ill, sadly on people dying, and also on our freedoms and local restrictions. But we also know that there are indirect impacts of COVID as well, and some of those on the economy, but also on the people attending for NHS services or the availability of NHS services. And our NHS partners are working really hard at the moment to start to, they had to keep enough capacity to deal with the sort of COVID crisis. And that did mean that they did stop some non-essential services. And what they're doing at the moment is working really hard to reintroduce those, what we call non-elective, so sort of planned services, non-urgent healthcare services, and they're working really hard to bring those in and reintroduce those, and that has really happened in West Yorkshire and in Calderdale. But what we also know is that there were we do have some evidence that people were worried about attending NHS services, maybe for some of the routine checks like getting immunised or having your diabetes looked after, and again so people potentially didn't want to take up some of those opportunities while the COVID crisis was is there, and it still is there in Calderdale. But health services are working really, really hard to provide services in different ways that are safe for people to access. So there's telephone consultations, there's video consultations, and there's also the separation of services where people may have COVID and people definitely don't, are seeking healthcare because it's where it's definitely not COVID. So the NHS is doing a lot of work to sort of re-establish and bring back up to speed all of the services that it had to temporarily suspend or slow down when we were seeing a lot of people needing healthcare. And although we've got a high rate of coronavirus in Calderdale compared to other areas, at the moment that rate is tending to be in people that are younger. and therefore don't need to use health services to the same extent as what we saw earlier in the phase of the pandemic. In March and April, we were seeing people in hospital and frail older people in care homes being affected. But at the moment, we're tending to see working age people being affected who are less likely to need health services. So this is a great time, really, for the NHS to pick up some of those non-essential health services. And when I say non-essential, that's the sort of it doesn't mean they're not essential to us. If we need them, they're really important to us, aren't they? I don't know if Alison or Amy want to add anything to the question about sort of healthcare services. If you've got anything to add.
Debs, can I follow on? It's less really about the healthcare services, but it is connected to a question that I've seen on the list we've got. And what it said is, are people doing something in Calderdale that they're not doing elsewhere, and is that why we've got the higher numbers of cases? And I really want to address that, because I know there's been comments made about some of the communities in central Halifax, and insinuations made really that they're somehow behaving badly or differently. And I really want to refute that. And it's linked to something you said about the indirect nature of people not going to the NHS. A lot of the reasons why rates are higher is people just going about their daily business as they were absolutely allowed to do after full lockdown was loosened and we had less restrictions. But there are social and there's economic reasons why the rates have become higher in certain parts of Halifax. And it really isn't because of people behaving badly. It's people just going about their daily business as they were absolutely entitled to do. And Debs, you've made the case that it's people of working age who are tending to pick up the virus. And I think that says a lot. It's a lot of some of the communities in that area, they'll be working in occupations that bring them into direct contact with other people. If you're a taxi driver, for instance, and you're in cars regularly with other people. And as I understand it, masks don't have to be worn in taxis, although they obviously should be, ideally. If you're working in a shop, if you're working in a manual occupation, and if the housing in that area, people just live closer together and their shops are nearby. So there's just simple reasons. It's not individual behaviour, it's social and it's economic. So I don't think people in Calderdale have been doing anything differently to anybody else. They were doing exactly what was allowed, but the virus spreads. We just know it. We have no immunity to it. It spreads. Some people don't have as bad a response to it. And so in some people we don't see it, and therefore it spreads more easily. So let's not think that we're doing something wrong in Calderdale, because I don't think we did. And I think you can see patterns around the country in certain areas where the virus has spread, not because of individual behaviour, purely because of socio-economic circumstance.
Yeah, that's a really, really important point. And I think just to add to what Alison said, looking at the data in Calderdale, we can really see the clear trace back to when the restrictions were eased. And actually, we had some of the lowest rates in the country during the national lockdown, which clearly shows that people of Calderdale know exactly what to do and were absolutely adhering when that was the rules. But as lockdown was eased, and people and some industries went back, some people started going about their lives in a different way. There are people who live in certain parts of the borough and right across the borough, actually, but in certain roles that are more likely to come into contact with the virus for no fault of their own. And actually, people in roles like manufacturing, food processing, shops, taxi transport and taxi, care, we need those people in order for us to live our lives. And they're really people that should be celebrated, like we celebrated the doctors and nurses in the earlier phase of the pandemic, but they're people who are more likely to come into contact with the virus just because of those jobs that they do. So I think I really would add and agree with what Alison's just said. And I think, you know, there's absolutely no evidence whatsoever that people in Calderdale are less likely to adhere to social distancing or the current, you know, the prior to our local restrictions, the situation, than anywhere else in the country at all. So I think it's really important. And I think the other thing that's really important for us to remember is, as you absolutely rightly said, that a lot of people don't have any symptoms of this virus. So they have absolutely no idea that they're spreading it, that they've got it. And they are not to blame for, and no one is actually to blame for, it's a global pandemic actually, and it's spreading right across the world. And it's something that happens, you know, every 20 or 30 years. And this is the worst one we've had for 100 years, but people aren't to blame for this. And I think it's really important that we understand that. Should I move on? See if there's another one for Amy. Is there another one? I can't see one. What I'm going to answer, if it's okay then, is just one that we've had, I think, quite a few questions about, which is around whether why certain parts of the borough why is the whole of Calderdale locked down, and why isn't it just where the infection rates are high? And I think again, I think there's a few reasons for this. I think the first reason is the law states that the lowest area that can be locked down is a local authority area. But I think, you know, what we've seen is as the restrictions, the national lockdowns were eased, we start to see, we knew we would, we start to see outbreaks, little outbreaks and little clusters, whether that be in communities, workplaces, care homes, schools, and local areas. And as that's happened, we've had a number of outbreaks in Calderdale. And that's what that's really shown us is how connected the borough is. So we've had outbreaks right across the borough of Calderdale, right in the upper valley and right down in the lower valley and everywhere in between and in North Halifax. But what we've seen is that the people that work in the places where the outbreaks have been also live right across the borough. So we've seen that, and not only in the borough, but in neighbouring areas as well. So we're really seeing strong connections between where outbreaks are happening, where people work, where people live, which indicate really that people don't just live their lives in the small area that they live. They live their lives and go to work in other parts of the region, actually, not just in the borough. So I think we're fooling ourselves if we think that a very localised lockdown in a certain area would actually stop the virus spreading. And actually, increasingly, you know, it's really important people understand we are seeing cases of this virus right across the borough. Yes, we have areas where we've got higher incidence, but we are seeing cases, you know, right across the borough, and we are seeing real patterns of travel for people. So if I was to show you a map of where outbreaks have happened, you would see that map would be right across the borough, not just in parts of Halifax that have high rates. So I hope that answers that question. And then there's a question here, Alison, around how communities can work together to beat COVID. Do you have any advice or any thoughts about how communities can work together?
Yeah, well, I think the first thing to say is that communities in Calderdale have been working incredibly hard ever since lockdown was announced on March the 23rd. It's been incredible, actually, and the sector that I work in, the charitable sector, has really been at the forefront of that. So emergency food parcels were set up immediately within a week of lockdown being announced to help people that couldn't go out and buy food because they were shielding or because they suddenly faced a massive dropping in income. And there's a whole army of volunteers stepped forward to set up some of these schemes themselves or to put themselves forward for the NHS volunteers scheme. So it's been phenomenal, and what I really hope is that spirit, community spirit, continues, because it was so obvious at the start. What will be a shame is I've seen, you know, there's been a bit of negativity, hasn't there, since we've come out of full lockdown. I felt that there's been a bit of sort of people seeing certain communities at fault and all the rest of it. And I think that's a real shame. I'd love to see that real community spirit continue. There's some great examples, you know, that where I work in Park Ward, a community fridge has been set up at the mosque. And it's literally a fridge where you can drop off food for other people, and you can just go in and pick up food from that fridge. And it's for anybody to take part in. There's St Augustine's, which is a community centre near to our own, where we're based on Hanson Lane, has been making food, which all sections of the population have been coming and collecting twice a week. So there's been a real upswell of community activity. And I think it's so important that we cling on to that during these, you know, really dark and difficult times for everybody in the borough.
Yeah, brilliant. Yeah, it's really inspirational actually to see the resilience and the kindness actually of Calderdale's communities, isn't it, during these times? And I think right at the beginning we saw lots of that, and it's really important, as you say, that we keep that and remember that. So I can see that I understand there's quite a lot of questions around children returning to school. I know we touched on this a little bit earlier, and I know we explained that we are going to be having another Facebook Live session on children returning to school next week. But I think what's really important to understand is that, you know, schools are working hard, and we will do everything we can to support children return to school safely. I do understand that there are sometimes particular concerns where there's a family member that perhaps was shielding, or perhaps where there's a family member in that, or a person in the household who's got an existing health condition, will be anxious about children returning to school. And so schools, there are really rigorous guidelines for schools for them to set up small bubbles of children where that almost become like a household with the teacher, where the school will be socially distancing wherever possible, and small groups of children will be in contact with each other. And what we'll do is we will work really quickly if there are. So at the moment, if there is a case of coronavirus associated with a school, we'll be notified very quickly, and we will close that bubble down straight away, so that the virus will not be able to spread, and make sure that people are protected from this. I do understand it's a worrying time. For children going back to school, but I just to assure you, there are teams of people working really, really hard, and I think at the Facebook Live that we've got next week, we'll be able to go into quite a bit more detail about the measures that are being put in place, the action that schools are taking. We're going to have a head teacher joining us, a school nurse joining us, who will be able to share real experiences about the things that they're putting into place. So I can see we've as I say, we've got a planned session next week on that. The other thing I think just worth talking about just really briefly is around shielding, shielding has been paused. Which we understand really how worrying that can be when our loved ones are medically vulnerable, and how frightening it might be to think that they could be exposed to the virus. And it's really important, actually. One of the reasons it's so important that we bring the infection rate down in Calderdale is because of protecting people that are medically vulnerable, and that's something we all have a really important role to play. The decision to stop the shielding programme in Calderdale was a national decision. But what we've done actually through our service, through our community hubs, is we have made contact with everybody that was shielding to ask them what support they need. Do they need any ongoing support? And we do want to, hear from people that feel that they need any additional support with the shielding programme ending. and we're asking everybody who was shielding to consider their own circumstances and think about the things they need to do to keep safe, and to protect themselves and their family members. So again, I'm conscious that we've got a lot of questions and comments coming thick and fast on YouTube and Facebook and Twitter, and we're trying to get through as many as we can. I've just had to go at doing a whistle stop of a bit on shielding and a bit on schools. And as I say, we will be focusing, have a whole hour on schools next week. Let me just go back through the questions to make sure that we're trying to get through as many as we can. Let's see what else we've got. There's a question about supermarkets. So this sounds like a good one for Amy and I to have a go at. So I'm going to ask Amy to start off. So there's a question about supermarkets, and lots of people don't seem to be wearing masks, and what we're doing to support supermarkets, and what we're doing to encourage people to wear masks. Do you want to have a go, Amy, at that one?
Yeah, this is something that's been fairly topical this week. So people in supermarkets not wearing masks. Obviously, we have to be conscious that there are people that are exempt, and we have to be careful around. And supermarkets we're conscious that supermarkets are quite cautious about asking people to wear face masks on that basis. But we certainly would encourage people. Debs and I have been out to a number of local supermarkets to encourage them to put out tannoys, reminding people the need to wear face masks, and that levels are high in those particular areas, and therefore emphasising the need for it. We've also had members of the wider team outside some of those supermarkets handing out face masks, and encouraging people going in to do it. The difficulty with the supermarkets is a lot of them are governed by national policies, and because there's been a relaxation across the country in a lot of areas, supermarkets have relaxed their restrictions. You know, maybe they've taken out one-way systems, they've taken out the queues outside. As such, we're a bit more reliant on people to wear face masks in order to sort of help a little bit. So it's difficult for us to enforce. We're asking the supermarkets to think about it in their assessment, perhaps think a little bit more closely about those supermarkets that are in areas where there is local restrictions. It's not a one-size-fits-all, and we're working to do that at the moment. With regard to individuals not wearing face masks, it's a police enforcement issue, so we're a little bit sort of stuck on how we do that. The police can't be everywhere all the time. That's a difficult one to deal with. But yeah, supermarkets are certainly trying to encourage display signs. Some are handing out masks themselves. I don't know if there's anything else I haven't really covered there.
I mean, I think you absolutely, and I think for me, one of the things that's really important is we are working really hard with supermarkets. We are trying to support them. We're giving face coverings out. We're encouraging them to do the same. We're encouraging supermarkets in Calderdale to sort of move away from the national policies, as Amy said. But I think the other thing I would say is that, I can't control what other people choose to do, but I can control what I do, and I will always wear a face covering in an indoor place, and for me, there's something about us all playing our part. If we are able to wear a face covering when indoors, in a taxi, on public transport, in a supermarket, in any sort of shop, if we're able to do that, we should do that. And we should also recognise that some people may have hidden disabilities that mean that they're unable to wear a face covering in those situations. And I think it's really important, going back to Alison's point about kindness and resilience, that we do what we can, play our part, not just for us, but for the wider community, because the more of us that wear face coverings, the less the infection will spread. And this is, some of these measures are what we call population measures. So they're about as many people as possible doing it, rather than stigmatising a small number of people that can't do it because they've got hidden disabilities or because of, you know, particular circumstances. So our job is to make it as easy as possible for people to wear face coverings and to take the other measures that they need to take to protect themselves and others, and to get this infection rate down in the borough, I think. And I can see another question, because I'm conscious that we're getting so many through. I want to answer as many as we can. There's a question about how frequently the restrictions are reviewed, and it might be just helpful to just give a bit of an update on that. So the local restrictions that Calderdale faces are reviewed every week. So they're reviewed at a meeting with government, with the Secretary of State, every Thursday, we understand. And then following the meeting every Thursday, we understand that there's an announcement if there's any changes made. So we usually expect, although it doesn't always happen, to get confirmation or an announcement about any changes on either a Thursday evening or a Friday. So they are reviewed weekly, and we are expecting them to be, you know, it's a Wednesday today, so we're expecting them to again be reviewed tomorrow. And obviously we don't know what the outcome of that will be, but I guess, as I said right at the very beginning of this Facebook Live, we would expect to want to see reductions sustained for a period of, you know, 1 to 2 weeks before we could be confident that there's actually a downward trend. You know, and for that reason, it may well be, and I don't know, but it may well be that restrictions that stay as they are. Although, as I say, I don't know what the government will decide. Shall we see if there's anything else anyone wants to add to any of the questions that they can see?
Debs, can I pick up on this?
Yeah.
You mentioned stigma, and I think we should address that. You know, we know there's some stigma from some people about they're worried about being seen to have COVID or potentially to have COVID, and I think that's why it's so important that we mustn't stigmatise anybody who's got this virus. I mean, it sounds ridiculous me even saying, how can you stigmatise somebody who's picked up a virus that just is out there in the community, and it's, you know, we know it transmits very easily. But I would say to anybody, if you think you've got COVID, you know, please go and get tested. It's really important. There is no shame in it. There's no stigma. It isn't your fault. Any of us could be in contact with it simply by touching something. That's why it's important to wash our hands constantly. We could be in the vicinity of somebody who's got it, and we, you know, and they transmit the virus through a cough or something. It's just so crucial that we don't, and that's why I do worry about certain communities being stigmatised or sort of assigning individual irresponsibility. Of course, there's people out there who are behaving in ways we wish there weren't, and there are in all communities. But I think it's really important that we accept our individual responsibility to contain the virus. But also, if it happens to you, and I do know people who've had the virus and actually they've been very ill with it, and thankfully they recovered. But they picked it up through the most innocuous, you know, of ways, just through relatives who'd had it. People from university who brought it back into the home. So I really would say to people, please go and get tested if you think you've got it. There's absolutely no shame, and it's really important that you do it.
Yeah, absolutely. Thank you, Alison. I think that's a really, 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 really important point. Yeah, really important point. And I think to add to that, what I would say is that actually by you know, by stigmatizing communities, you know, we make people feel excluded, we make them feel you know, blamed, which is all really bad, you know, and not something we would want communities to feel through no fault of their own. But in addition to that, by stigmatizing people and blaming people, we actually stop them, being, they're less likely to be tested, they're less likely to tell their employer, they're less likely to come forward if they've got symptoms, if they feel blamed. So it actually works against containing the virus as well, stigma. So it's really important for all of us, whether it be because we're kind, which I think the vast majority of people in Calderdale are, or whether it's because we really want to get these infection rates down. Stigmatising and blaming communities is not going to help us do that in any way. Anything else? Anything, Amy, I'm conscious of the time. Anything, Amy, you would like to add that you haven't had the opportunity to say, or Alison, either of you?
I think really I'd just like to say, to make it easier for our businesses, a lot of our businesses are doing really well at the minute. We're generally very impressed how hard they're working to comply with the regulations and guidance. Members of the public need to help them do that by also following the regulations and guidance for themselves and their households. So if we all help each other, it makes things a lot better. Yeah, we're generally quite happy with a lot of our businesses. It's very important that they are doing a very good job. The small minority are not so good, and we're helping them to get it right.
Yeah, absolutely. And this is the sort of thing that none of us can do on our own. We all have to work together on, isn't it? And businesses, organisations, communities, members of the public. It's the only way we're going to get our rates down to where we want to get them, so that we can all get back to the things we used to take for granted. It's got to be us all working together. That's what's worked in other areas, and we can learn from other areas of the country that have successfully done this. But it takes a team effort. And no single organisation or no single function can do this on their own. So I think it's really important. I think just reinforcing Alison's message, I think what I would say is, if you have symptoms, do get tested. If you get contacted by the test and trace service, which do please follow their advice, and we have got a local test and trace service now that started today, which will be going out and sort of using our knowledge of our local communities to reach people that the national service hasn't been able to reach. But it's going to be really important to follow the advice that the test and trace service give people. And then what I would say is it's really simple. Avoid crowded places, avoid close contact with people, adhere to the social distancing as much as possible. If you're indoors, with people that are outside of your household, outside of your normal work, wear a face covering. I think it's really simple, as much as you can if you're able to. And, the real other key message, which we can't stress enough, is hand washing and respiratory hygiene. So the catch it, kill it, bin it sort of message is really, really important. And if we all do that, and we do some of the things we're doing by engaging with our communities, being kind to each other, supporting businesses and doing enforcement when we need to, we'll be able to bring this virus under control and as I say, hopefully get our freedoms back as soon as we possibly can. Don't know if Alison, if you want to add any conclusions, conscious it's 8:01. Is there anything you would like to say?
I'd just like to agree with what you've just said, Debs. For me, I mean, you would expect this. I work in the charitable sector, in the voluntary sector. We're all about community. The only way we can get through this is to work together and work collaboratively with one another, share messages, challenge gently. That's fine as well, I think. but we will get through it together, but not by spreading some of the sort of conspiracy theories that you see online and that sort of thing. I think it's about following very simple, clear messages that you've just given us, Debs. Hand washing, face masks, and just don't get into crowded places if you can help it.
Yeah, brilliant. Thank you. Well, what I'd like to say is that just to summarise a little bit, if that's okay for everybody, we've actually been overwhelmed with questions, and we've had 500 plus more than 500 questions and comments come through on the streams. So what we're going to do is we are, as the council, we'll review the comments. And we will try and, update the information and respond to the questions and comments that we've had. If people follow our social media, we will aim to add further information and advice to answer the questions that you've asked tonight, because you've obviously asked lots and lots of questions we just haven't had time to get through. And I would just like to reiterate that, we have got another Facebook Live Q&A next week on Thursday the 27th. We're going to confirm the details of that on social media tomorrow, so we'll tell you then who the panel are, and that'll be because we have had a lot of questions about schools, and it's understandable that people are concerned about schools, and so I think having colleagues from children's service, school nursing, I think I'll be there again, and a head teacher as well. I think will really help us get a real sense of what schools are doing and what we can all do so that children return to school safely. And I'd just like to thank you all really for so much interest and so many good questions. You always ask brilliant questions, and I'm so sorry we haven't managed to answer them all. And I'm really grateful to the panel, to Alison and Amy for joining us this evening. And thank you very much, and look forward to another one of these on schools next week. Thanks everyone. Bye.